I come to the floor today to discuss more of the troubling news that has come out about how the health care law has affected the people of this country. A new poll just came out from National Public Radio, as well as the Robert Wood Johnson's Foundation. This is what they found. According to the poll, 26% of Americans are telling us that the health care law, Obamacare, has directly hurt them. 26% of Americans say the Obamacare, the health care law, has directly hurt them. Only 14% of the people in the poll said the health care law has gotten, that their health care, personal health care, has gotten better under Obamacare. So it's just 1 in 7 say it's better. Over a quarter say they have personally been hurt. So almost twice as many people have been directly hurt by the law compared to the people who've been helped. American taxpayers are also being hurt by Obamacare because of the waste and the fraud in the health care system. There's a new report just out from the Government Accountability Office. It came out last week. It found that the Obama administration is still failing to stop the fraud in health care subsidies. Now, here's how the law was designed to work. People must have government-approved insurance because of the law. It's a mandate. There are a lot of people who have been forced to buy very expensive insurance to comply with the law, and in many cases it's far more coverage than they want, that they need, or they can afford. So the health care law that the Democrats voted for, that the Republicans voted against, said that the government will give subsidies to people to help them pay for this Washington-mandated expensive insurance. To get the subsidy, people are supposed to be able to prove that they're eligible for the subsidy, and there are various criteria to make sure that you're eligible. So that means things like proving that they make a certain income, or how many people are in their family, or that they are a citizen of the United States, or that they are here legally. So Washington then pays the subsidy directly to the insurance company. And then later, the government comes around to try to figure out if the person even qualified for the money. So there's a huge potential for fraud and for wasting taxpayer dollars. This new report from the Government Accountability Office found that despite the billions of dollars at stake, the Obama administration has taken what they describe as a passive approach to identifying and preventing the fraud. The Obama administration has taken a passive approach. It says that the Obama administration has struggled to confirm the eligibility of millions of people who applied for subsidies. This is a report from the Government Accountability Office. We want accountability in government. The report found that there are 431,000 people who still had unresolved issues with the subsidy paperwork, more than a year after they first applied. The cases amount to over $1.7 billion in taxpayer subsidies. Now, the insurance company, the insurance coverage that these people had for that year, it's already ended. The Obama administration still didn't know if they should have gotten the money that was sent out to the insurance companies on their behalf. There are another 22,000 cases where it still isn't clear if the person who got the subsidy was serving time in prison. How can Washington not even know if someone is in prison? This should be one of the easiest things to find out. Look, there are millions of cases where the administration is taking this passive approach to figuring out if there is fraud occurring with these subsidies. People all around the country are asking, where is the accountability from the Obama administration? They're spending billions of taxpayer dollars. Where's the accountability to make sure that it's being spent properly and not wasted? There is no accountability because the Obama administration doesn't seem to care about protecting taxpayer money. It cares more about getting a large number of people enrolled in insurance. That's what they want, no matter what the law says, no matter how much money they waste to do it. Now, this report from the Government Accountability Office came out last Wednesday. And the very next day, there was more bad news for taxpayers because of the health care law. There was an article in the Wall Street Journal Thursday, February 25th, under the headline, "Insurance Fight Escalates." It goes on to say, health co-op leaders say the effort to recoup federal loans will come up short. This is taxpayer money. Remember, the health care law gave out billions of dollars in loans to set up these health insurance co-ops across the country. They set up 23. Already, more than half of them have collapsed and have gone out of business. 12 out of 23 have gone bust. 700,000 Americans lost their insurance because these co-ops failed. And now it looks like hardworking taxpayers are going to lose the money that the government loaned to these failed insurance businesses. According to this Wall Street Journal article, leaders of the co-ops say that taxpayers are going to lose more than $1 billion of the failed co-ops. They say it's because most of the money has already been spent. The article quotes the head of the co-op in New Mexico saying, will there be any money left? Yeah, maybe. That's what he said. That's his answer. Yeah, maybe. Maybe there'll be a little money left out of more than $1 billion in taxpayer loans. It's outrageous. It wasn't supposed to be a bailout of the insurance company. These were supposed to be loans. Is that how the administration think that loans are supposed to work? Does the Obama administration think that if they lend out money, people borrow it from the taxpayers and spend it, then they don't have to pay it back? Where is the accountability from these co-ops for the American people? Where is the accountability for the Obama administration to make sure that they loaned this money responsibly and didn't waste it? Reports like this paint a very bad picture of health care and the health care law in this country. And then just yesterday, we talked about these co-ops, 23 co-ops, half of them have failed. This is headline yesterday, losses deepen for the remaining Obamacare co-ops. It says losses snowballed in the fourth quarter of four co-op plans have now reported their numbers for 2015. The article says the nonprofit startups based in Illinois, Wisconsin, Ohio, and Maine lost about $270 million last year. That's more than 5 times the level of losses the plans recorded in 2014. That was the first year they operated. They're still waiting for the updated financial reports on the other 7 remaining co-ops who have not yet posted their returns. So here we are. 6 years ago, there was a debate in Congress about America's health care system. Everyone in this body agreed that we had a problem. Everybody agreed we needed to do something to help Americans. Republicans presented our ideas on the floor of the Senate. We went to meetings at the White House. We offered President Obama solutions. Democrats and the president rejected our ideas, and they came up with their own massive plan. Washington took on too much power over the health care decision of American families. More Washington control, less Washington accountability. They're never the right answers for our country. If Washington can't protect taxpayer dollars, it shouldn't be collecting so many of these dollars in the first place. Republicans warned that Obamacare would be bad for patients, bad for providers, and terrible for the taxpayers. And the news keeps coming out showing that we were exactly right. So Republicans are going to continue to talk about our health care ideas. We'll continue to talk about ideas that will actually hold Washington accountable as Washington spends taxpayer dollars. We'll continue to talk about ideas like giving families more control over their health care and their health care decisions and giving Washington less control. That's what Americans want. This new report out from the National Public Radio, this poll, showed 26% of Americans say that the health care law, Obamacare, has directly hurt them. Directly hurt them. They don't want help. They didn't want this kind of health care reform that directly hurts them. Instead of helping them, they wanted to be helped. They don't want an approach like we have. They want an approach that gives them control, and certainly not a passive approach to preventing fraud. The American people do not want Obamacare. Thank you, Mr. President. I yield the floor.